Hello everyone, welcome back to the Diary of an Endodontist. Have you ever had those cases where you can see caries and it looks very deep and you cannot see the end of it and you don't know if you can save this tooth or not? So this is that typical case where the granulation tissue is already inside of the margin. You cannot see without removing it first. Of course, you can take an x-ray and that x-ray will guide you where the margin, the healthy margin should be. But is that margin healthy enough for you to rely on to put a new filling or a new crown? Well, the first thing you need to do is to isolate this tooth. And you say, oh, Danny, but I can't really see when I isolate. No, you are not isolating it properly. You can see. What you cannot see is when you have the granulation tissue over the margin. It's not the rubber dam that is interfering, it's the granulation tissue that is interfering. So you need to remove that first, and you need to remove the decay as well. First of all, remove the decay. You can have a carbide and you just slow hand piece and just gradually remove that soft tissue, that decay that is compromising your margin, and get this margin really solid and healthy because you need to bond over it. Another thing, I know that you need to do the root canal treatment. Best thing is to build that wall first, because once you start using sodium hypochlorite, that will interfere with your bonding. So it's better to first of all, it's a lot easier as well to first of all build that margin, and that will secure your sodium hypochlorite and will not allow that to go under the rubber dam. So it's easy to do that way. Remove the decay. Most of the time when you are with the carbide, you will remove the granulation tissue as well. But if you can't remove that, a good tip is to use your hot tip. The hot tip is when you put inside at the very end of the margin to PDL, you just remove that, heat up, and that will cauterize or will stop the bleeding for you. And that's when you can adapt the matrix. The half matrix or segmental matrix or partial matrix, that's the one that you are going to do mainly if you are isolating this tooth already. If you can, isolate the tooth behind and put, including the rubber dam, 3 teeth. It's a lot easier. Now you can build the wall with a good edge-bond composite system, and you are now ready to do your root canal treatment. Once the root canal treatment is done, then you are ready to fill that tooth with a nice composite polish and leave it all ready, either as a permanent filling depending on the size of it and depending on the occlusion, or if you want that to be a core for the onlay or for a crown. That's the result, the final result, with the filling in place and the root fillings, and the patient is stable now, ready to start cleaning this area. You need to spend time teaching your patient how to clean. The flossing in that area, paramount, is so important, because I normally say to the patient that this is a weak link. So the composite to the tooth is a weak link. If you explain that way, the patient will understand that if the food goes in there and if they are not careful enough cleaning, there is a chance the bacteria will find a way in again and recontaminate the whole canal. And it's not that the root filling is there that will block everything. No, the bacteria can find a way and can navigate through and go up to the end of the root, and the whole thing will start over again with the pain, swelling, and all of that. So explain that to your patient so your patient is on board with you. It's not only you in charge of the treatment for that treatment to be successful. Your patient has a big role in it, so you need to get the patient on board with you. Hope that helps now with those cases of deep caries, and I want to see more teeth being saved now. Thank you.